Things here are this: first order neuron, second order neuron, third order neuron. First order, second order, third order. You can see the arrows. It's telling you it's going up. It's telling you it's an ascending track. Okay? You don't have to differentiate lateral and anterior spinal fluid tracks. Just spinal fluid track, first order, second order, third order. Any questions about those neurons? Any questions about what's going on right here? Decussation. Alright? So, as usual, I'll show you all the pictures, then I'll go down through the test, just like I always do. Yay, next picture. What's that, folks? Read it before you answer. Ascending or descending? Descending. Two skeletal muscles. Two skeletal muscles. Doesn't tell you down there, but it's going to a skeletal muscle. So this is my upper motor neuron. This is my decussation of the pyramids. This is my lower motor neuron. This is my pectoralis major muscle, bench pressing 350 pounds. So see all that? Why are you laughing? I don't know. Four. It's four. Yeah, it's one of the fasciculi. It's showing you that they all don't decussate at the decussation of the pyramids, and these are running down through. It's just part of. Yeah, but not all of them. This one didn't. This one did. Yeah.
So would we have to know the name?
No, you never had to. You never had to memorize these tracks, or did you? No, you just called them the cortical spinal tract. Cortical spinal tract. You had to know pyramidal and extrapyramidal. You had to know that the pyramidal tracts were called cortical spinal, but you didn't have to memorize the fasciculi in there, or did you? No, you didn't. You absolutely did not. I told you during the lecture. I said, don't just know pyramidal and extrapyramidal. I said the pyramidals are called cortical spinal, but then with the extrapyramidal, I said don't memorize any of them. And then I went through this whole diatribe about you already know the rubrospinal because it's going to the red nucleus or wherever, and tectospinal. I went through that whole thing, but I said you don't have to memorize those things, and you don't.
Would you just talk briefly about the difference between pyramidal and extrapyramidal?
Yeah. Pyramidal are primarily voluntarily controlled muscles, consciously voluntarily controlled muscles. And the extrapyramidals are your reflexive and postural and subconsciously controlled muscles. Extrapyramidal are your subconscious, basically. All right, that's the biggest difference. All right. Remember the routes that the sympathetic nerves take? If you look at the videos. This is a spinal nerve route right here. So here's what's happening here. Preganglionic neuron, right here. White ramus communicantes, synapse, gray ramus communicantes. Back to the spinal nerve. This is the spinal nerve route. However, similarly, but a little bit different, preganglionic neuron, right here. White ramus communicantes, synapse, sympathetic nerve. This picture is showing you two routes, the sympathetic nerve route and the spinal nerve route. And on the lecture, I traced both of these out and I talked about both of them. Okay? This is the sympathetic chain ganglia. This is the sympathetic chain ganglia. Any questions about this? It's on the test. On the lecture, I did trace it out for you and showed you the difference. So make sure you go back and look and listen at that, because I talked about that quite a bit. I don't think there's any more pictures. But I do want to tell you, so I want to talk to the pictures. Okay, I have over 50 questions on this test right now. I haven't whittled it down to my 50 or 40 I'll probably give you. I don't know, the pictures I've shown you so far are definitely on it. I don't know if this picture is on it, but I want to show you something. You're responsible to know how this path of the light gets to the retina. This path of the light hits the cornea, goes through the aqueous humor, goes through the pupil, hits the lens, goes through the vitreous humor, hits the retina. So even if the picture's not on there, you're responsible for how the path of the light gets to the retina. You're also responsible for how the sound wave gets to the cochlea. Goes through the external auditory meatus, it's the tympanic membrane, goes malleus incustapes, round window, perilymph, round, vibrate the basilar membrane, bend the hairs here. So, I don't know if this picture's on there. I want to be clear. I don't know if it's going to be, but you're responsible for the path of light through.
This little light?
Because it's really an anatomy thing, and I leave it for lab. But you are responsible for tracing sound wave into here, vibrating these three ossicles, round or oval window. You're responsible for how the sound wave gets in there. So I probably won't leave the picture on the test, but I want to be clear, you guys have to know the sound wave going in. Now let me run through this test. You guys email each other and all that stuff? Can you guys email the rest of the class and say, hey, I'm posting these, you missed review? Or only a subset email each other? Use the Facebook page. And everyone gets on it.
Everyone can get on it.
Ashley and Robert get on it. You don't know that, but they're all friends. Ashley and Robert are friends.
I know Ashley gets on it. I don't know about Robert.
I'll email Robert.
I'll see.
Yeah, I can text him later.
Okay, so you communicate with him then.
Yeah.
Make sure he knows that the video of the review is on there, okay?
Alright.
All right, so here's what you need to know. And remember, like always, this is not the only thing you should study. This is just kind of a gist or a focusing activity. Okay, make sure you know what gustation and olfaction mean. Make sure you understand that olfaction is a primary receptor and gustation is a secondary receptor. Make sure you know what tonic and phasic receptors are. Tonic receptors are slow adapting receptors and phasic receptors are fast adapting receptors. Make sure you know basically what you knew for today's lab practical. That naked or free nerve endings are pain, temperature, tickle, itch. Make sure you know Pacinians are deep pressure. Make sure you know Meissners and Merkels are light touch. Okay, things like that. Make sure you know those receptors we talked about. Okay, the ascending tracts. You don't have to memorize all of the fasciculi. You absolutely do not have to memorize those fasciculi. But you have to understand the ascending tracts have three orders of neurons: first order, second order, third order. You have to know that they decussate. You absolutely must know that the dorsal column medial omniscience tract does not carry pain. The spinal thalamic tract carries pain. Spinal thalamic carries pain. Dorsal column medial omniscus, also known as the posterior column, does not carry pain. Make sure you know that most of these go through the thalamus. Of course, the spinal cerebellars don't, but everything, just about everything else goes through the thalamus. And that picture I showed you. All right, for descending tracts, make sure you understand there's at least one upper motor neuron. Oh, I'm going to say it like this. I don't want to say it wrong. Make sure you understand that there's at least two neurons, an upper motor neuron and a lower motor neuron. That's a minimum of what has to occur in a descending tract. Please don't memorize all of those fasciculi. Here's what you have to know. The pyramidals travel in the cortical spinal tract. The pyramidals are predominantly a conscious voluntary muscle contraction. The extrapyramidals travel in a whole bunch of different tracts, like the cerebrospinal, tectospinal, vestibulospinal, all those, but don't memorize all of those. Just know that the extrapyramidal tracts are a subconscious level, automatic subconscious level. A lot of reflexes occur in those extrapyramidal tracts. Okay? Make sure you absolutely know that the precentral gyrus is your primary motor area and your postcentral gyrus is your primary somatosensory area. Actually, today in lab, and on the lecture, on my annotated area lecture, when I did that, those two gyri, I said, you must know this. I'm going to test you more than once on it, and I'm going to test you more than once on it. And the picture. Okay, for the spinal cerebellar tracts, it's important you must know that sometimes they don't decussate, sometimes they decussate once, and sometimes they decussate twice. What this means ultimately is this. Each hemisphere of the cerebellum gets information from both sides of the body. That's really what that means. The right cerebellum gets information from the right and left side of the body. The left cerebellum gets information from the left and the right side of the body. That's what that means. So the spinal cerebellar tracts decussate, don't decussate, and sometimes decussate twice. That makes sense? Okay, the autonomic nervous system. Make sure you know thoracolumbar and craniosacral. Thoracolumbar is sympathetic and craniosacral is parasympathetic. Make sure you know the preganglionic fiber is myelinated and the postganglionic fiber is unmyelinated. Hence the gray and white ramus communicantes. You should probably put that together by now. Make sure you absolutely know the neurotransmitters. Acetylcholine from the preganglionic fibers and acetylcholine from the postganglionic fibers of the parasympathetic branch. But norepinephrine and epinephrine from the postganglionic fiber of the sympathetic branch. Make sure that you know muscarinic and nicotinic receptors for the acetylcholine. Make sure you know alpha 1, alpha 2, beta 1, and beta 2 receptors for the norepinephrine. However, I know you're writing this down, and that's fine. Who didn't hear the lecture yet? Be honest. Okay, let me tell you something. At the end of my lecture of the autonomic nervous system, I show you a chart, and I say to you, I'm going to give you this chart on the test. You can use this chart on the test. So I'm going to give you that chart from your chapter on the test. All right? But in my lecture, I go through how to read the chart. And I was just going to pull it up right now, but I'm not doing it. You want to know why? I want you to listen to my lecture. So you need to go back and listen to the lecture and look at it and see the chart I'm talking about and realize I'm going to give it to you. And I think I say something what I thought was funny. I said, don't print out your own because I don't want you writing anything on the back. I'm going to give you a clean copy. But that chart that lists the sympathetic and parasympathetic nervous system on one chart, it tells you which receptors. It tells you that. And it tells you what it does to the organ, whether it vasoconstricts or vasodilates or causes urination or inhibits urination or whatever it does, it tells you all that. You can use that chart on the test, but let me warn you, people think that that's the greatest crutch in the world and they don't listen to how I'm telling them to read the chart and they miss 8 questions or whatever, and I tell them how they could have gotten that answer off the chart. They say, well, I didn't understand I could have gotten that answer off the chart. I said, well, I showed you how to get the answer off the chart. Just having the chart in front of you doesn't mean you will extrapolate the answer. You must understand how to extrapolate the answer. But what it does mean is you don't have to memorize every receptor on every organ and every neurotransmitter and every synapse. It tells you that. That chart I will give you. Sometimes I don't think I'm doing you a favor by giving it to you, but I don't want you memorizing a ton of stuff. Okay, the picture of the sympathetic nerve pathway and the spinal nerve pathway. I ask you questions like this, which the chart will help you. I say it's a parasympatholytic. What's parasympatholytic mean? It inhibits the parasympathetic nervous system. It's a drug that inhibits parasympathetic nervous system activity. What's parasympathomimetic mean? Mimics the parasympathetic nervous system. So, I give you drugs. Drugs that have effects similar to those of the sympathetic activation are called sympathomimetic drugs. Which of the following would you not expect to observe in a person who has taken this blank drug? And you can actually get this from the chart, but you have to be able to know how to read the chart. Drugs known as beta blockers may be useful for treating blank. All you got to do is go up to your chart, look at all the beta receptors, say to yourself, I'm blocking them. What is it doing? What's it good for treating? By the way, do you guys know what beta blockers are used for treating?
Thyroid?
Tachycardia, I heard. What else? Right, you got it. Tachycardia, hypertension. You got it. Because what it does is slows the heart rate down, lowers your blood pressure. Yep. Okay. You have to know what the word intramural means. Intramural ganglia. In my lecture, I talk about these differences between the sympathetic and parasympathetic nervous system. I show you how the sympathetic has a relatively short preganglionic fiber, except for the adrenal medullary route. And I show you how the sympathetic has a relatively long postganglionic fiber. Of course, the exception is the adrenal medullary route. That has an extremely long preganglionic fiber. But that's the exception. Then I tell you how the parasympathetic nervous system has a really long preganglionic neuron. Matter of fact, it goes right to the organ where it's heading in a lot of cases. And it actually synapses intramurally, which that means is in the capsule of the organ. And its postganglionic fiber is really short. So they're opposite in those ways. Sympathetic, short preganglionic. Parasympathetic, long preganglionic. Sympathetic, long postganglionic. Parasympathetic, short postganglionic. So I talk about those in quite a bit in that lecture, or at least for a few minutes, and it'd be good if you knew that. All right, special senses. Again, olfaction and gustation. Olfaction and gustation. Before I mentioned it, because I want you to know what a primary and a secondary receptor is. Now I'm mentioning it because I'm talking about olfaction and gustation. And of course, olfaction is a primary receptor and gustation is a secondary receptor. Make sure you know gustation goes to the insula. Make sure you know what a G protein pathway is. How G proteins turn on cyclic AMP or calcium second. So G proteins to cyclic AMP and G proteins to calcium. All right, here's a question. A ray of light entering the eye will encounter the following structures in which order? No pictures. You've got to pick one of these orders that works. I have an order. I thought I accidentally left it. I have an order that works. All right, pupillary muscle groups are controlled by the autonomic nervous system. Now, that means you better know this. First of all, the oculomotor nerve goes to the pupil, goes to the pupillary muscles. The iris it goes to. The iris is the pupillary muscles. The autonomic nervous system goes to them. The oculomotor neuron that goes there does a parasympathetic activity, and it causes vasoconstriction. It tells your pupillary sphincter muscles to contract and the circular muscles close. The sympathetic nervous system goes to the pupillary dilator muscles, and it dilates your pupil. And I definitely talked about this in the lecture. I drew arrows and I pointed to and stuff like that. So make sure you know that, because it combines 2 chapters for me, so I know I'm hitting 2 chapters when I ask that question. So that's pretty cool. Here's a question for you. Trace the circulation of aqueous humor from the site of production to the site where it is reabsorbed. Trace it. Alright? Starts in the ciliary body and is reabsorbed in the canal of Schlemm. I'll let you guys look up the rest. I did it in the lecture too. Make sure you understand the optic disc is a blind spot. I don't even know if that's really a question I would ask. We should understand it. Now, make sure you understand how 11 cis retinal is changed to 11 trans retinal by light. And make sure you understand how 11 trans retinal turns on transducin, which activates phosphodiesterase, which breaks down cyclic GMP. So what do? I close the sodium channels. So what do? I hyperpolarize. So in the light, I hyperpolarize. In the dark, I have a dark current. Who didn't watch this video yet, these videos? Okay, it's a very counterintuitive concept, because you would think that you would depolarize in the light and you would see. No, you hyperpolarize in the light, but you still send the signal. I tell you how. You depolarize in the dark, and it's called the dark current, but you don't send the signal to the brain. It's kind of counterintuitive. You've got to go in there and look at that. Make sure you know the general rod C in the dark and cone C color. Make sure you understand how we recycle the retinal and opsin after it's bleached. A lot of you haven't listened to the video yet. What happens is when light hits your rhodopsin and 11 cis retinal is changed to 11 trans retinal, to get that back to be functioning again, you disassociate them. You enzymatically reconvert 11 trans to 11 cis, then you reassociate them. What's it called when they're disassociated? Bleached. And then they reassociate and they're ready to go again. Make sure you understand about the semicircular canals in the crista ambularis is angular momentum. Make sure you understand that the macula and the suprabolus saccule is linear acceleration or static equilibrium. Make sure you understand how we hear, how the basilar membrane moves and bends the hairs. All right, now, I wish you guys would have listened to this lecture before today. In the ear, in the hearing part, there's another very counterintuitive thing from what you've been learning. Endolymph surrounds my hairs of my organ of Corti. Endolymph looks like intracellular fluid and it's high in potassium. So when I bend those hairs and I open my tip link, what rushes in and depolarizes it? Potassium, because the endolymph is rich in potassium. So you're going to say, are you telling me I depolarize with potassium rushing in? Yes. Yes. You're going to say, that sounds weird. I agree. Back when I was teaching you the normal way we depolarize and repolarize and stuff, I alluded to this and I said there's a couple weird things coming up in the retina and in the ear. But for right now, let's learn the rules. So we learned the rules. Now we're breaking the rules. Okay. The retina breaks the rules and the ear breaks the rules. We gotta learn how we break the rules. Here's the question. The following is a list of the steps that occur in the production of an auditory sensation. What is the proper sequence for these steps? Want me to read it again? The following is a list of the steps that occur in the production of an auditory sensation. What is the proper sequence for these steps? And that's it, folks.